Interstitial cystitis is one of those interesting disorders that we often find more in females, but also in males. It is almost like an autoimmune disease where your own body's immune system will attack your bladder wall and cause symptoms. So it is a predominantly painful bladder disorder. There are other conditions that can also cause a painful bladder, but interstitial cystitis is one of those conditions that will severely affect our patients' lives because they will have constant pressure feeling on the bladder, constant feeling of they want to go to the bathroom, have a smaller bladder capacity, and sometimes that is associated with incontinence or leaking of urine as well. We think that the causative agents is normally an infective agent like a virus or a bacteria, but it might also be an allergy. This causes severe swelling of the bladder wall and the lining of the bladder, and that makes that the bladder is very sensitive when it fills up and becomes very painful. We make the diagnosis by excluding infections. So we examine the patient, do a urine examination, make sure there's no other underlying abnormalities like bladder stones or tumors or cysts. And then we would normally do a cystoscopy, which is an investigation that we do under anesthesia. And we have a look inside the bladder. We look what the bladder wall looks like, what the lining looks like. We would mostly do a sample of the bladder wall to send away for histology, that they can look for pathology in the bladder wall, and then also do a treatment of laser or cauterization of the bladder wall if there is significant ulceration or pathology. The condition can mostly be treated, but it does take time, and if left untreated, it might severely affect the patient's quality of life in the long term, where he or she might not be able to have a normal social and professional life.